Morning. Thanks for joining us here today. Said to Manitobans a couple of weeks ago that when we, Dr. Roussin and I, Dr. Roussin who joins me here today, who you're familiar with by now, I expect, that thanks to Manitobans following Dr. Roussin's wise orders, we would have a big day, and we did, and we announced the loosening of some restrictions. And I said at that time that if we keep doing the right things and following those orders and protecting ourselves and one another, that there might be more big days. Today is another big day. C'est une grande journée pour les Manitobans, une autre grande journée. 2 weeks ago, for the first time in over 2 months, we were able to make some modest changes to our public health orders and begin the process of safely and gradually reopening our economy and our communities. These are cautious changes, and they were the result of Manitobans' willingness to do the right things. Their dedication, your dedication, to follow the advice of Dr. Roussin, our public health leaders, to do everything you can to protect yourselves, to protect your loved ones, to protect our healthcare system, to protect our community. Over the last 2 weeks, that work has continued, your work has continued, and it must continue. If we want to reap the benefits of successfully bending that curve, we have to keep bending it down. When Manitoba's COVID cases continue to trend in the right direction, that's great news, but I must remind Manitobans that we are not out of the woods yet. We must stay on guard. Bien que le cas de COVID au Manitoba continue d'évoluer dans les bonnes directions, je dois rappeler aux Manitobans que nous ne sommes pas encore sortis du bois. Nous devons rester sur nos gardes. The risks of new COVID variants are real. The risks of vaccine shortages and delays are real. The risks of reopening too quickly are also real. We must and we will proceed with caution to ensure we continue to protect and safeguard Manitoba lives. Today we're here to ask for Manitobans' input to help inform our next steps, as we have at each step of the way. And I thank Manitobans for providing us with their views. Their feedback matters to this government. We are a government that listens. And today, as we consider loosening some restrictions, even when it is safe to do so, we will again ask Manitobans to participate in the Engage MB process. Brent, I'll pass it over to you, sir, for further elaboration.
Well, thanks, Premier. Good morning. Right now we're in a much more stable place than we were, certainly in November and December. We are not seeing an evidence of a spike in numbers related to the last set of very cautious reopenings. And so our numbers have been steady and trending in the right direction overall. We remain in a very crucial part of our pandemic response. And again, these upcoming weeks are going to be quite telling as to the success we're going to be able to enjoy moving forward. The fundamentals are going to reply for the foreseeable future. Physical distancing, washing your hands frequently, wearing a mask, and again, staying home when you're ill are all going to be quite important. And this is, even if you're just mildly ill, just very mild symptoms, we need those people to stay home and get tested. And all of these activities are going to help us continue our progress for reopening. We want people to be at home isolating if they're waiting for test results. In fact, anyone in your household waiting for test results, we want you at home waiting for those results. So given this current situation, the trend in the right direction, the province is considering the following changes for all of Manitoba. So the province would remain at level red, but these restrictions would, or these proposed changes would apply for the entire province. So under consideration currently is allowing food services, including restaurants and lounges, to reopen to 25% capacity with a closure time at 10 p.m., but limited the patron groups to household members only. Allowing personal services including nail salons, tattoo parlors, to reopen at 25% capacity with adequate physical distancing, enhanced personal protective measures, as well as requirements to collect information for contact tracing purposes. Allowing gyms to reopen at 25% capacity for one-on-one or individual training with adequate physical distancing and protocols. This would not include group classes. Allowing places of worship to reopen at a maximum of 10% capacity with a cap of 50 people, whichever is lower. Allowing libraries to open at a maximum of 25% capacity, and again, any groups must be limited to household members. Allowing organized outdoor sports to resume for games or practices. However, multi-team tournaments of any kind would not be allowed. Clarifying the orders that addiction support and treatment groups can operate with adequate physical distancing measures in place and proper protocols. Allowing the film industry to resume work with safety protocols in place. Opening of public washroom facilities with 25% capacity and enhanced signage and protocols. We're increasing capacity for weddings up to 10 people in addition to the officiant, as well as in the addition to a photographer. We'll also allow photographers to return to service in studio, catering only to household groups, as well as outdoor functions. So these are under consideration for the next stage of reopening and would come into effect next week to replace the current health orders that expire on 11:59 p.m. on February 12. So at the latest, these new restrictions would be in place at that time. These changes would see the province remain in that critical level of red, which highlights the actual level of risk we're in. We have yet to get adequate supply of vaccine. We're under threat of the new variants of concern. So our numbers certainly allow this continued cautious approach to reopening, but we're still at a very critical juncture moving forward. This proposed plan will bring the entire province under the same restrictions, so this would include the Northern Health region, so the same set of restrictions would apply everywhere, and the restrictions that were in place now that weren't listed would remain the same. So household visitor restrictions of up to 2 designated people, 5 people plus members of a household and outdoor private property. Retail stores open at 25% capacity with that cap of 250, whichever is lower, with the adequate physical distancing, and then under the personal services, hair salons, barbershops would still be open at the 25% capacity. So we're going to continue with this very cautious approach. We can't open everything at once. We certainly don't want to open, close, and then have to reopen again. And so we're going to do this gradual step. And as we open, adherence to these protocols and these regulations is paramount. So certainly enforcement will be out, but these orders are allowing us to get back to some of the things we miss and love, but we have to do so in a very cautious way, or we're going to be at risk of having to shut down again. So, definitely we all recognize how difficult these restrictions have been on Manitobans to various degrees. It's taken a toll on all of us. It's been quite a difficult year for us, and especially the last couple months. But it should be clear we just can't open everything at once. We're not ready to go back to normal. In fact, we've been here before. We've been in this exact position before, right? These are the numbers we had in early October. And at that time, we lost track of those fundamentals. And then we saw what happened in in November and in December, leading to where we are now. So as we reopen this, let's remember that we are definitely here before, and we kind of let the virus slip away from us at that time. So let's keep the virus under control. Let's get back to the things we miss, but in a cautious manner. So let's keep focusing on those fundamentals, protect ourselves, our family, our loved ones, our community, and we'll continue to make these sacrifices in the short term, but we know that this pandemic will come to an end. But we're still at a critical point right now. So thank you, Manitobans, and I'm going to pass it back to the Premier.
Thank you to you, Dr. Roussin, and to your team for your tremendous leadership through this entire time. Yeah, we don't want another November, but Manitobans are smarter now. We know. Perhaps we let our guard down last year. We didn't really have the experiences that many others had. We had very, very low numbers, and they came up suddenly, and they came up because we forgot the fundamentals, as Dr. Roussin said. So today's a good day, and I have good news, but I also have bad news. The good news is that we learned yesterday that Manitoba's vaccination team is second in the country in administering both doses of the COVID vaccines and providing the fullest protection possible from this deadly virus, and that's great news. Manitoba, again, second in Canada in getting that second vaccine out. That's the one that really makes a difference. That's the one that gets you to 95% protected according to the manufacturers and the testing that's been done. So again, thanks to our vaccination teams for that crucial work. But here's the bad news. That's just like being the second best player on a team in the bottom division if you're playing soccer or curling. It's not a great thing because we're behind so many other countries when it comes to getting the vaccines out, and we're limited by that. This is a chart from a couple of days ago showing Canada ranking 29th. The bad news is we're 33rd as of today, according to the Globe and Mail. So we're falling behind other nations in respect of getting the vaccines here. If we had more vaccines, our team's been building up and continues to build up its capabilities here. We have hundreds of Manitobans working diligently to get the capability built to get those vaccines out. We could vaccinate everyone in the next 10 weeks if we had vaccines, but we don't. Why are we behind? There are a number of reasons the federal government has given for this, principally because we have fewer vaccines. Fewer vaccines available doesn't stop us from preparing if we have more, but it does mean that the federal government has to step up and get more. This is their responsibility. They took away all the province's ability to buy vaccines, to order vaccines some months ago, and I know that they're working very hard to catch up. And we had an announcement this week that was a good announcement about the federal plans to ramp up domestic production. But that domestic production won't be up and ramped up until year end. So better late than never. But this idea of a September herd immunity is looking less and less realistic now. Now, why am I raining on the parade? Why am I telling you this? Well, you know why if you've been watching these. It's a marathon. It's not a sprint. And we have to learn to live with COVID, as Dr. Roussin has said so many, many times. And if we do learn to live with COVID, and if we keep demonstrating that we know what to do in terms of the right fundamentals, then we're going to have more days like this in the future. But if we forget, that's not likely. So here's the really, really good news. With cautious and steady progress and a continued demonstration of the reality that we can work with COVID and we can beat COVID together, we're going to get through this, and we're going to get through it together. As Dr. Roussin has outlined these measures today, we must remember this does not mean, it will not mean, a return to normal in a short time frame. So I encourage all Manitobans, go to engage mb.ca, fill out the survey. Please give us your feedback on the proposed measures that Dr. Roussin has shared with you today. And I know that some of you will say we're going too fast. And I know that some of you will say we're not going fast enough. And my old dad used to say the surest way to fail was to try to please everybody, so you know me well enough to know that I'm not trying to do that. I'm trying to do the right thing. We don't need a yo-yo. If we go too fast, we're going to end up having to pull back, and that's not good for our small businesses or any of us. So we better not go too fast. But to those of you who say we need to be afraid, caution's a better word. We need to be cautious. Caution's a better guide in making decisions. There's no risk-free decision here. We're going to make difficult decisions. We're having to choose among different restrictions at different levels. That's not an easy thing to do. It's not easy for any of us to have to abide by these either. But the right thing is to abide by them, and the right thing is what we're going to do, because we're not going to be governed by fear in this province. We're going to be governed by caution. Caution means we have the right to keep our hope, and we have hopes. We've earned the right to have those hopes. So as Dr. Roussin has mentioned, And I will repeat, the next few weeks are going to be crucial to us. We have a duty to abide by these rules. We'll firm them up next week based in part on your advice. And if we follow those rules and if we abide by the fundamentals, we have every reason to be hopeful and we have every reason to be optimistic. But caution must be the word we use, and our actions taken will reveal that caution. Be careful. Limit your social contacts, even though we're broadening those opportunities. We do not want a COVID party every time that we get together. Soyez prudents, limitez vos contacts sociaux. Nous ne voulons pas de soirée COVID à chaque fois que vous réunissez. This isn't the time for non-essential travel. Stick to the fundamentals, limit your risks, avoid the 3 C's: close contact settings, crowded places, closed spaces. Wash your hands. Stay home when you or any member of your family is sick. Wear a mask. Limit your close contacts. Stay positive. Stay supportive of one another. And stay hopeful. Thank you. Look forward to your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this morning from CBC Radio Canada, Camille.
Hi, Dr. Roussin. I would like to know if it will be the responsibility of the restaurant to verify the addresses of their customers' homes.
You know, as we were talking that, with this loosening, we're still in a very critical part. So we need to ensure that these measures are adhered to. Like we said, we've been here before. We can't let October and November happen again. So we are going to look at that. We want the restaurants to be open. We want people to be out and be able to enjoy this, but it has to be households only. So that burden is going to fall on the people going out, as well as the patrons, so as the owners. So we're going to have more details on that, but there are everyone's going to share the burden on this to adhere to these requirements.
Thank you for that. And for organized outdoor sports and games, do the players will have to wear a mask even outside or not?
When we have our mask restrictions, we've usually said, while you're engaged in the physical activity, you don't require it. I think it's a good idea. I think organizers of these events should think of ways to work that into it. It's probably not going to appear in the restriction that you must, but remember, we're at that stage where a lot of people want to get back to these things, and we want to keep the progress going. So everyone should be thinking of ways to go above and beyond to keep us all safe.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. Given the varying states of the pandemic indicators in different parts of the province, why would you be looking at these for all of the province and not just the southern half?
So right now, this is what we're proposing. Again, this is a list of proposals, so it may not look exactly like this as we start to implement it. But I think that we saw something that at least compromises to some degree our ability to do the regional approach when we did this with the northern restrictions, where we saw a lot of travel down to the south for shopping for non-essential services. We are concerned that if we open up restaurants per se in the south, that we're going to see that travel coming down to the south. So for right now, we're proposing this as province-wide. But of course, that could change within the next week or so.
Thank you very much for that. Mr. Premier, you've seen around the country examples in Ontario, examples in other provinces, examples right here in Manitoba that when officials, appointees travel, the public reacts really negatively because they feel that it's two sets of rules. Why did it take so long for you and your government to react to the WHA chair appointee and come up with the change you announced on Monday?
Well, I think I have to take exception to the preamble a little bit, Bartley, because I think the doctor and I have made it eminently clear what we think of unnecessary leisure travel for a long time. The directive I put out this week was designed to give additional clarity to that, and that there would be consequences for people who do travel beyond the restrictions when they come back. And those career-limiting moves that people may choose to engage in have consequences. So if you're going to put leisure travel ahead of public safety and public health, there's a consequence for that. And I think our appointees, over 1,000 of them, who are volunteering on agencies, boards, and commissions, need to understand that going forward, we'll expect them to remove themselves from those appointed positions if they decide that fun in the sun is more important than protecting each other here in Manitoba.
From the Canadian Press, Kelly.
Hello, Dr. Roussin. How do you rectify that you can only go to restaurants with members of your household, that you can play on sports teams or go to church services with a wide array of people?
Yeah, so thanks. So, the church services, again, we have very limited capacity, and so any groups at church services, I don't think I clearly listed that here, but the order would require that groups at faith-based services could only be household members. So we're not going to see that interaction there. We know there's lower risk in outdoor activities. Certainly not zero risk. So all of these organizations need to think about ways to protect their members, and just like usual, the orders can't work in every possible scenario. We're trying to get back to the things that we feel are important, that are healthy, that people are missing. And so the benefit of getting back to that outdoor rec is important. It's going to be outside with a lot of safety measures. And then for the restaurants, where we know that these are those enclosed spaces, this is prolonged indoor contact. We're going to be extra cautious with household members only.
And Premier, what conversations are you having with your colleagues across the country around issues with the vaccination supply chain? And how has Ottawa responded to those concerns?
Well, we've had bi-weekly calls with the Prime Minister, bi-weekly calls as a minimum with all premiers on. The Council of Federation has been in regular contact and discussion. Certainly vaccine shortage is the number one issue right now, I think, for most provinces. We know the capacity's there, and it's been building up for some weeks in anticipation, and now is continuing to build up. So the limiting factor is clearly vaccine availability, has been well reported. Here's Tuesday's Globe and Mail, again yesterday, again today, and the number one story in the national media is the vaccine shortages and what we're going to do about it. Other countries have moved ahead of us. This is going to mean lives will be lost. The federal government has said it's going to step up now. It's a concern to every premier. I had conversations yesterday with two premiers who both said they anticipate now herd immunity is a thing that won't happen until 2022 at the earliest. That's where their numbers are. That's what they're saying. That's too bad. It's extremely sad. But the point, I think, here in Manitoba is if we just follow Dr. Roussin's advice and continue to, we'll persevere, and we'll be able to learn to live with COVID, because the cavalry's not at the crest of the hill right now when it comes to Ottawa providing us with vaccines.
From CTV Winnipeg, Jeff.
Well, hi, Dr. Roussin. I'm wondering what happened last year in November. Where did the spread come from?
Yeah, and so, when we started looking at later October, early November, what we started seeing was widespread community-based transmission. So when we saw the extreme growth that we were seeing throughout November, by definition, a large proportion of it we weren't able to connect it. So we just know it's where people gather. Early on in that second wave, we, as you recall, it was the younger cohort, that 20 to 44-year-old cohort, that was very high numbers to begin the second wave, and then later, just like what we see in any outbreak, then that starts to transmit to all age groups. Certainly at that time, we saw a number of the cases linked, not necessarily acquired, but linked to places like bars, like restaurants. Again, it's when you're dealing with community-based transmission, it's very hard to definitively link it to that, but that's where we were at that time. So, again, we're having extra measures put in place right now for that safety. I think Manitobans all are reflecting at that time where we entered into October with the numbers exactly how we are right now, but then saw November just 1 month later. With the skyrocketing cases putting our acute care system at risk. So I think we've learned, I think we've been able to reflect, and I think with this cautious reopening, we'll still have success.
And sorry, I know you were already asked this off the top, but how are businesses going to ensure that it's a household only? Are you just looking at numbers, or are you looking at you have to be part of that nuclear household? You
have to be a household, and so that's going to be the requirement. Again, we're floating these loosenings right now. We don't have any definitive answer, but what I would say is that because this is a broad loosening at a critical stage, we're going to do whatever we can to ensure that these are adhered to. Everyone should want every Manitoban, every business to adhere very strictly to these requirements, or else we could look at November again. So we'll have more details exactly on how it's going to be enforced and what kind of burden it is, but we're going to expect that at restaurants, sitting at the same table is only going to be household members.
This is a kind of red tape, Jeff, that I think our business owners will welcome. It's eminently easy to keep track of who comes into your restaurant when it's closed, and so complying with these requirements is something I believe that the restaurants will welcome and want to be part of, because it's true. I think that most of our small businesses have gone over and above to try to protect their customers, to try to adhere to the health orders, but this is clearly a necessary part. If we go with this will be a necessary part of your responsibilities in reopening.
From City News, Jonas.
Good morning, gentlemen. Thank you for this morning. Dr. Roussin, first question for you today. One of the key indicators as we look at the reopening, we've said time and time again, is hospital capacity. Maybe just a note or a message on what we've seen over the last couple months since the restrictions went in, and why we're confident the capacity is there.
So as we've saw the case numbers drop and test positivity drop over the last month, we've seen along with that a drop in hospital admissions and in hospital bed utilization. We've seen that drop or a drop in ICU demand. However, we haven't seen it drop as quickly as we anticipated, or certainly as quickly as we would like. So we know there still are some demands on the healthcare system. In saying that, the healthcare system has been able to, again, gradually get back to a lot of the work that they had to delay during the very high levels in November and December. So as long as we keep the numbers down in this area, our healthcare system is going to be there for all Manitobans.
Thank you for that, sir. As a quick follow-up, as we do this reopening, it is going to pretty much depend on the actions of Manitobans, right? Like, as we saw in the fall, you can open it and you can put in restrictions, but if folks don't follow, I guess that's going to be the crux of the whole thing.
Yeah, and I think that works both ways. I think with when we're in these very tight restrictions for 2 months, we put that into jeopardy as well on the COVID fatigue. And so I think being able to have some very cautious openings under very strict restrictions, has that ability to increase adherence. Because we've had that ability to reflect on what happened just months ago, which seems almost like forever ago right now. But I think going forward, we're going to need adherence to this because really the last thing we want to do is to have to shut things down again, to go backwards. So we're really going to be relying on Manitobans. We're going to be relying on them, but we're also going to be there in enforcement to ensure Manitobans are following these restrictions.
Jonas, if I could pitch in on that one too, I think it's pretty clear to me that Manitobans are even more aware now. We've never let up on the advertising. Dr. Roussin, myself, health ministers have constantly, Lynette Saragusa, constantly have been putting out information, but we also had a lot of activity on our websites with additional information, and I know that that's helped. But what's really helped, I think, is the word of mouth of Manitobans talking to each other, speaking to each other, educating one another about the consequences of not distancing. And sadly, we know from too many examples, too many personal hard stories, how this has impacted on families and on our seniors in particular. And because of that, I think Manitobans are in a different place now than they were perhaps in October. And I think the place that we're in now is we're all in this together now in a more genuine way, and I hope in a more productive way as we move forward than we were back then. And so the future's in our hands, and literally, we need to remember that these fundamentals matter.
From CHVN, Taylor.
Hi, good morning. Dr. Roussin, you're proposing the reopening of places of worship. Can you just explain a little bit more about why you're doing this when you were previously opposed to it, and why the 10% max capacity when it's the lowest capacity out of all the reopenings?
Yeah, and so remember, all of the restrictions are based on the risk of transmission. So, in the past, it just depends on the level of risk we are able to tolerate. Right now, where we are with our numbers, with our test positivity, we feel we are able to open in some capacity. Again, closed spaces, prolonged indoor contact, that's where the real risk is. And so there's a setting like places of worship meet really all three of those criteria. When we look at retail, these are 25% capacity, but again, these are people walking by each other. They're not in the same room for an hour or more at a time. So we think that the 10% capacity deals with that. We think any grouping within that 10% capacity will have to be households. And then again, we know that they're just like retail outlets. There are settings that have very large amount of capacity, and we just don't feel that hundreds of people under the same roof right now is appropriate. But we do recognize that we want to try to get back to things that people miss and people love, but got to do it in a cautious way.
And we're seeing some unusual patterns when it comes to our homeless population here in the province, including more people sleeping in bus shelters. Premier Pallister, how are you feeling about what's happening with our unsheltered Manitobans?
Well, we've taken constant efforts to support our most vulnerable populations. I know that the vaccine team has already had in discussion, though I don't believe they've announced it yet, some specific strategies to assist the homeless population in being able to get vaccines earlier rather than later because of the more vulnerable nature of the lifestyle. We'll continue to offer those supports to our most vulnerable citizens, and we'll continue to. In fact, a study just came out last week, I believe, that showed that we're second in the country as a province, as a provincial government, in offering additional funding support for programs largely directed to our most vulnerable population. Ahead of every other province, I believe BC was first, we were second in that study. And we're designing programs to support people and to help them commensurate with the needs that they have, and our homeless population, of course, needs our support and help now.
From the Winnipeg Free Press, Larry.
Premier, a week ago you expressed some sympathy for folks in positions like Wayne McWhirter's because of their largely volunteer role, as you put it. On Monday, you issued a directive putting more than 1,000 of such appointees on notice that if they travel for leisure purposes outside of Manitoba, their appointments will be revoked. Could you describe how your thinking evolved on this issue, and what changed between last Thursday and Monday?
I tend to think about things, Larry, before I act. I think that's the appropriate way to lead and to govern.
So, so you spent the weekend thinking about the situation I'm taking. How is the government going to enforce the travel restrictions on members of more than 150 agencies, boards, and commissions? Are you going to rely on the honor system?
Well, actually, Larry, it's way bigger than that. This directive went out to everyone in government, top to bottom, everybody, all of us, because you can't, I don't think at this point we can relax our attention to what we're talking about here today. What we're really focusing on is loosening restrictions cautiously while we protect the safety, health, and well-being of others. And if our people in government are placing their own desire for fun vacations away from the country ahead of adhering to Dr. Roussin's guidelines, my directive is designed to make sure they understand that'll be a career-limiting move.
From Global News, Joe.
Hi there, Dr. Roussin. Last time during the Phase 1 reopening, you were considering loosening restrictions on household gatherings to allow for any 2 people over, and then changed it to a designated 2 people. Why isn't that being considered at all this time?
Well, so it was certainly considered in our deliberations and prospects for what we could do here, but really it's you know, all of this is trade-offs, right? We know with this virus, it's interactions that result in transmission. So the more person-to-person interaction you have, especially in closed spaces, crowded spaces, prolonged indoor contact, puts us at risk. So, you know, so it's really the trade-off. Did we want to increase the amount of people that could visit at a house and keep restaurants closed, for instance? Or would we rather open restaurants with reduced capacity but keep the meetings at home to where they were? So these are the type of balancing things we do and priorities. So, you know, we're going to hear back from Manitobans as well on this. But I think that, you know, where we were right now, this is a prudent plan that we have in place.
And yesterday we got a best case scenario for the vaccine rollout. Do we ever expect something similar for a reopening plan, like a best case reopening plan similar to the vaccine plan?
You know, I think that, you know, the vaccine rollout plan has, you know, not as many variables. You know, right now it depends largely on supply. The vaccine implementation task force has done such an amazing job with logistics and planning and being able to ramp up the delivery of the vaccine. You know, really the only variable is delivery of the vaccine itself. So you know, so a plan like that is feasible. For us, there's just so many variables. You know, from between now and the next orders, we have so many indicators we're going to follow. We're going to follow where transmission may be taking place and adjust things. So. You know, so I'd say the best case scenario is that our numbers continue to trend here, and we just gradually reopen, you know, reopen everything with caution.
From the Brandon Sun, Colin.
Morning. Mr. Premier, we've had at least one Order in Council appointee here in Brandon leave their board. The new rules. Do you know if there have been any other such resignations, and are you concerned about how many appointees might resign as a result of this new rule?
No, I'm not concerned in the least. I think the right thing to do is to make sure that all our appointees to agencies, boards, and commissions were thanked for their volunteer service, largely volunteer service, and that they were let know that if they wish to travel for leisure abroad during this time of COVID, that they would be expected to resign. And so that's the measure that we took on Monday to make that clearer. I'd hoped it would have been clear before, but it was made eminently clear on Monday. As far as those who choose to do that, I would want them to know that I don't agree with their choice, but I do thank them for their service. And we have other people who are quite excited and willing to take over from them. And that's exactly the step we'll take. We have a normal turnover of agencies, boards, and commissions members. I'm proud of the work we've done to change the way those people are appointed. They're scrutinized. They are appointed on the basis of merit and qualifications, not patronage. And we now have a record number of women on our boards, the highest in Manitoba history. And so we've worked very, very hard to have good people on our boards, and I don't expect that you'll see a rash of people leaving those boards because of the fact that they are honorable and smart people. Going forward, though, if they do feel they have to travel abroad for some reason, they will be expected to resign.
My second question is for Dr. Roussin. I see that you're thinking of changing the capacity for weddings, but what about funerals? Are you considering allowing more people to those, or are you intending to stay at the current 10-person limit for now?
That's right. Yeah, this is more about bringing the weddings up to where we increase the funerals and the last orders, and then we'll continue to look at that capacity as we move on. But for this set, we have not planned on increasing funerals further. We did increase them with the last loosening, but they would remain the same at this time.
From CJOB, Clay.
Good morning, Dr. Roussin. Good morning, Mr. Premier. Now, I believe this question has been asked, but Dr. Roussin, if all goes according to plan, in the best case scenario, restaurants will be allowed to reopen next week, and I'm sure the restaurant owners are on pins and needles about this. I'm sure there's thousands of people who would love to go to a restaurant, sit down, have a good meal, but there are many, despite even if they are allowed to reopen, are going to be very leery to go. Do you think with the limited capacity, you're reassuring people that it will be safe to go to a restaurant?
Yeah, I think that during the first round of reopenings, I said this, is that there's nothing that I would suggest in a reopening plan that I wouldn't do myself. So, I think that our numbers staying this way, we reopen at 25% household members. You might spot me at a restaurant with my family.
Clay, if I could pitch in on this, I don't think there's anybody who's worked harder, not just to follow the guidelines that Dr. Roussin and I have repeatedly outlined, but also gone over and above that than small business people in our province. And the reason is, maybe this is going to sound a little cynical, but the reason's pretty simple. They like repeat customers. They want you to be healthy and happy and come back with your family. And they're going to do everything they can to make sure the experience is a great one when they have the chance to do that again.
Okay, thank you for that. My follow-up, by the way, Dr. Roussin, if you go to a restaurant and I'm there, I'll wave it. My follow-up is, if and when these new variants show up in Manitoba, how, Dr. Roussin, is that going to change your game plan?
Yeah, and so this is one of the risks we're facing right now. So at the same time where we're facing concerns on vaccine supply, we're also facing concerns of variants of concern, which have more transmissibility. And so this definitely has the ability to affect our epidemiology. So we have plans right now. We're actively searching for this variant. We have many measures in place to protect against its importation with our self-isolation requirements for travel. And then we're working on public health measures right now that if we do detect it, things like contact tracing and isolation periods and infectious periods will be affected when we see that. So we plan on being very aggressive. It's very likely that we will see this variant of concern introduced into our province, but we'll be ready to ensure we're very aggressively contact tracing and controlling it.
Our final reporter this morning from the Winnipeg Sun, Scott.
Good morning to both of you, Scott Bill, Winnipeg Sun. Dr. Roussin, you've talked about how the current spread, or the spread last year, the situation essentially right now is similar to what we were before restrictions came into place last year, but the second time last. But what are the differences? Like how does now in terms of risk compared to the risk prior to the restrictions that were imposed last October?
So like I said, and like you just said, is that we've been here before, and so the risk overall is much the same. It's just how we deal with that risk. And so we're loosening things now. We're not loosening them as much as, say, we were in October. We did see a lot of transmission in the younger cohorts in the early second wave, and that dealt with a lot of the bars, which were not opening at this point. We're opening restaurants and lounges, but with even stricter capacity issues because we're only allowing household members to be sitting together. So the risk is still there. As long as this virus is circulating, with the vast majority of Manitobans still susceptible to acquiring it, we're at risk. So we need to continue to practice those fundamentals, to keep our contacts down, and we need all Manitobans, all business owners to step up and to ensure they're doing whatever they can so that we can keep our progress of reopening going.
Scott,
all right, thanks for that.
Hi, Scott. If I could, I'll just say you're a sports guy, so am I. We got much the same personnel as we had last fall, but we started losing, and we lost badly because we stopped playing defense. Now we've learned, and we're all learning how to play defense. And as we learn how to play defense against COVID, we can afford to give ourselves fewer restrictions because we've earned that right. And I think that's what's happened over these last few months. We'll see as Manitobans decide whether they want to keep playing defense or not. But following Dr. Roussin's fundamentals is playing good defense against COVID, and that's what we need to keep doing.
Thank you. And just a final question. What, I guess for Dr. Roussin, what about single people going out to restaurants? Can they take one or two of their designated, household members with them? Would that be allowed, or are single people just only supposed to go by themselves if they're going to a restaurant?
Yeah, and this gets back to, again, it's tough to write these orders cautiously and then have the, affect every potential eventuality. So really the answer is household members only. We didn't want to include household members plus the two designated. We know that's really impossible to try to enforce, and so this is an opening when we're still at a critical stage. So we know it doesn't benefit, say, everyone to the same degree, and just like any of the orders, you're always going to find certain situations that might not fit, but we can't write orders that way. We can't slow our progress because of that. So for right now, it's household members only, and we just have to really reduce the risk.
I want to say thanks to everybody for your questions and for listening in today and watching, and also to say I encourage again all Manitobans to look at engagemb.ca, fill out the survey, give us your feedback on these proposed measures. Your voice matters, and we're listening, and we appreciate your attention to this. Thank you.